Welcome to BRMC Healthy Connections. I'm your host, Tobias Pugsley, and with me today is the newest addition to Baxter Regional Medical Center's Oncology Department, Dr. Lattanzi. So when we come back, we'll talk to Dr. Lattanzi, find out how he's settling into our wonderful area and how things are going over in the Oncology Department at Baxter Regional. Welcome back to Baxter Regional Medical Center's Healthy Connections. Today with me, very special guest, Dr. Lattanzi. Dr. Lattanzi, welcome to the area,
Good morning.
first and
Thank
foremost.
You. Very nice to be here.
Tell us how you came to find this little jewel of Mountain Home and came to be with us.
It really is a beautiful place. I'll tell you, I practiced in Connecticut for the past 20 years, practiced oncology, cancer medicine there, and we raised our 5 kids up in Connecticut. And the time came when the littlest one graduated from high school, went off to college, and we now have 5 in various stages of higher education around the country. And Jody and I, my wife Jody and I, decided it was time for something new. Baxter Regional Medical Center was advertising for a new oncologist, so I came down to see the place in the winter. And I thought it was a beautiful place, a wonderful medical center, a beautiful area. Came back and had a good talk with Jody and with our kids, and we decided this was what to do. So we came down in August, and I started practice on August 29th.
August 29th.
That's right.
So you've been here just long enough to kind of get your bearings, and what's your favorite thing about Baxter Regional and specifically the Mountain Home area so far?
Well, Baxter Regional is a wonderful medical center, and it's really great to see in such a quiet, peaceful countryside kind of town, such a great full-service medical center that I might really expect in a bigger city. It was 269 beds, more than the hospital that I left behind in southeastern Connecticut. And it is a friendly, caring place with just about every service you would need to deliver oncology care. One of my favorite things is that it's very uncommon to have to send a patient elsewhere for any kind of service, because just about everything you need is available right here at BRMC.
Wow, that's absolutely incredible. And then what a resource for, the members of our community to not have to make those long drives to Little Rock and Springfield and Fayetteville and Jonesboro to get those types of treatments. It's great that you're able to do it right here at Baxter Regional.
That's right. Thankfully, there are major medical centers available for the rare things that we have to send patients out for, a bone marrow stem cell transplant or something like that. But I don't believe I've sent more than 1 or 2 since I've been here.
Wow, that's incredible. So if I'm a newly diagnosed patient perhaps, what can I expect whenever you take over my care? What should patients come to know about you and to expect whenever you're taking care of them?
Well, I'm someone who believes in close communication with a patient. I love my patients to think of me as someone they can always talk to and bring their questions or concerns or anything else. I'm always available, and I'm always willing to see a patient on the same day that they call if necessary. They can always reach me. I'll try to explain everything carefully in plain English and hopefully not medical terms, things that everyone can understand. And I want to deliver state-of-the-art medical care, the same medical care that you would get anywhere else. I think that you can get right here in Mountain Home.
Wow, that's absolutely incredible. And what are, for some of our listeners, what are some of the things that you have the ability to treat, so to speak? What services does the Cancer Center offer?
This is a wonderful cancer center. It's a caring, compassionate place, but it's also state-of-the-art. We deliver our chemotherapy and our other infusional intravenous therapies right on the spot. There's a great center with 2 chemotherapy certified nurses and 12 infusion chairs. It's a warm, friendly, open air kind of place where people can sit and get their treatment. We've got all the radiology, all the imaging services that you need to get state-of-the-art cancer care, all the tests that I would need to send patients for, including CT scan, MRI, PET scan, and full 3D mammography, which is very good to see.
Wow, and it's all right there at your disposal, so to speak.
Right
too.
there at Baxter Regional, that's right.
That's incredible. I think a lot of people probably didn't know that, we have that available, right at our fingertips, so to speak, and that's absolutely incredible. And also you have Dr. White over there, I understand?
Dr. Bruce White, who's been here for years, and he's been very gracious and welcoming me to the practice, and it's great to work with him.
Between the two of you, just kind of see that our cancer center and our abilities just kind of go to the next level from everything that I've heard. So welcome. We're really, really excited to have you. So 5 kids, that's absolutely amazing. How is it managing an oncology practice and in a full household?
I have a wonderful wife, Jody, who with me has raised these 5 kids, and I believe she has done the lion's share of work. Jody is a critical care nurse, and she has lots of experience with dealing with crises, so
wow.
Our kids are always well cared for. There are 5 smart kids, and they're all, as I say, scattered around various institutions of higher education. Some are in Connecticut, some are in New York, and one is in Virginia. He's the one that's closest by.
Wow, so they are all spread out then.
We're looking forward to having them all back for Thanksgiving and for Christmas very soon.
It's right around the corner.
That's right.
It must cost a fortune to feed that many kids.
Well, we're officially empty nesters now, so
yeah.
They're all out at college, so our grocery bills have gone down.
Yeah.
But that'll change in a few weeks when Thanksgiving comes around.
Spiking for the holidays.
That's right.
All right. Well, as soon as we come back, we'll talk more with Dr. Lattanzi about the Baxter Regional Oncology Program, and we'll get some tips and some tricks on what you can do to possibly prevent cancer, and things you can do to increase your healthy lifestyle to hopefully not ever have to see them.
That's right.
All right, we'll be right back after these messages from our sponsors. Welcome back to Healthy Connections. I'm here today with Dr. Lattanzi. We're having an excellent visit about him being new to the area. And now, Dr. Lattanzi, maybe you can tell some of our listeners at home maybe some things they can do to help prevent cancer so that they don't ever have to come see you.
That is the best outcome. If they don't have to see me, that's great. A lot of the things we can do to prevent cancer are well known. First of all, I think everyone knows we shouldn't smoke. We should quit smoking if we smoke, and there's lots of techniques available to help with that. Smoking is responsible now for about 27% of cancer deaths in the United States. So if people would quit smoking, I might have to take up dermatology or some other specialty, which would be fine. But there's lots of things available to help us quit smoking, and there's a lot we can do there. Lung cancer, which is the biggest smoking-related cancer, is now the single biggest cause of cancer death in both men and women in the United States. It passed out breast cancer some years ago.
Wow.
So there's a lot we can do there. We can also be sure to avoid excessive sun exposure, wear a sunscreen if we're going out, and we can pay attention to our diet. A healthy diet with plenty of fiber, low fat, and not excessive amounts of meat. We don't have to be vegetarians, but limiting excessive meat consumption can help prevent colon cancer and maybe other cancers too.
That's incredible. So there's a lot of little things that we can do, just changing our daily habits, that can help prevent some of these things.
Absolutely. Did I mention smoking? Don't forget.
And we actually do have free smoking cessation classes available through the Pites Cancer House.
Absolutely.
And so if somebody does want to try to stop smoking, we have resources available from the hospital to be able to do those things. And obviously to your point too, if you quit smoking, think about how that percentage drops as far as your risk factor. So if I'm potentially diagnosed with cancer, Dr. Lattanzi, and I come to you, what are some things that make me a better patient, so to speak? Meaning, what can I do? I mean, I know now a lot of times patients will do research and they'll come and they'll probably have all this information, available at their fingertips. But what can I do to kind of help you do your job better?
The most important thing is to communicate and tell me what your concerns are, what your questions are. Write them down before you come in, because a lot of times in the medical visit, it may go right out the window. We may get talking about other things and it may slip your mind. But many patients will come in with a prepared list of questions, and that's absolutely great. Another great idea is to bring someone else, a family member, a friend, or significant other that can help be your eyes and ears and help you remember to ask things or bring up things that you haven't brought up. Having that support with you at the time of the appointment is very important. And always remember that you can call afterwards if there's something you've left out, something that did go out the door and you didn't answer or didn't ask at the time of the visit. Bring it up later, give me a call, be very happy to answer it. The more I know about you, the more I can help.
Right, that totally makes sense. And as a potential patient too, what are some things that I'm looking for? I'm sure there's probably a lot of signs and symptoms, for the various different types of cancers, but if I have a little mole, or if I have a little stomach pain, what are some things I need to look at as kind of early warning signs for different types of cancer?
Sure. First of all, anything that concerns you is always worth a call, and we'd be very happy to tell you nothing's wrong, and that's great. But you should be concerned about a change in a spot on the skin, a mole or a wart or something you thought was fine but starts to change. That's always worth a call. Change in your bowel habits, blood in the stool, things like that are worth a call. Any kind of lump or mass that doesn't seem to belong there, any of those would be important warning signs.
Key indicators.
Absolutely.
Yep. And do I have to go through my primary care physician as a first step, or do I call directly? What's the best route for that?
If you haven't seen me before, you'll need to get someone to refer you, and it's always great to have a primary care doc involved. But if you're already our patient, you can always give a call. We're happy to take care of that.
Excellent. And you are taking new patients.
Absolutely.
So the phone is always open.
Sure it is. Absolutely.
Yeah. So you've lived here since August, right?
August 17th.
Yeah. So have you got a chance to do any fishing or be out in the outdoors any at all?
Jody and I don't fish. We haven't learned that trick yet. We could, but we've always loved to be out in the outdoors. We met in New Hampshire when I was in training, and we always loved going out in the countryside. And the beautiful surroundings here are something that really attracted us. We love Bull Shoals, we love Norfolk Lake, and we have 3 excellent dogs, small, medium, and large, who all love to go out in the woods, and we love to take them on little hikes.
Really?
That's what we do.
That's incredible. How is it keeping up with a dog of each size?
It's great. It is wonderful. They each have their own little personality. They're like their own little people.
What kind of dogs are they?
They're all poodles.
All poodles.
We got a toy poodle, a miniature poodle, and a standard poodle. And they range from 5 to 50 pounds.
Oh, wow. That's incredible.
So I guess we're empty nesters, but not really.
Not really,
We've got the 3 dogs at home.
No, dogs can be more demanding than kids sometimes.
That's true. That is true.
Well, that's absolutely incredible. Well, is there anything else you'd like to tell the viewers out there about, you or your practice, or anything else going on that you think they need to know?
I'd like to put in a plug for screening tests. There are tests that healthy people can have to detect cancer or precancerous conditions before they cause trouble. Mammograms are very important. They should start for women at age 40, and the frequency after that is variable based on the individual patient. Colonoscopies for both men and women to detect colon cancer or precancerous conditions usually starts at age 50, but maybe sooner if you have a strong family history. Pap smears for women beginning at age 21, and thereafter based on what they find in their own personal history. And maybe the PSA blood test for men to detect prostate cancer. It has its risks and benefits, and it's not the same answer for everyone. that one's very important to discuss with your own doctor.
Excellent. These are all things that you can do to help, because we all know the earlier that they catch it, the better chance you have of being able to fight it more efficiently.
Absolutely.
Yeah. Well, thank you so much, Dr. Lattanzi, for being on with us today. You know, Healthy Connections and a way here to kind of to get in the living rooms with our potential patients and educate them. I really appreciate it. I know you're busy. You know, I know you have a lot of patients to see, but I do thank you for taking that time and coming on here and telling folks what they need to know about cancer.
I appreciate the opportunity. It's been great to be here.
All right. Well, thank you very much, and we'll see you next week.